Good morning and welcome to all. I am Riya Shah and I welcome you all here for today to our webinar on prediction and prevention of Parkinson's disease by our beloved Dr. Sarosh Katrak. I am. It is my utmost pleasure to introduce our CEO, Dr. Maria Barreto, today. But before we do that, there's a small video from our founder, Dr. Padma Shri Dr. B.S. Singhal. I would like you all to see that video.
Our mission at the PDMDS is to reach out and enrich the lives of persons with Parkinson's disease. We do this through a multidisciplinary approach, and to this end, we have established a network of support centers across the country to meet their unmet needs. Thank you.
So that was the message by our founder, Dr. B.S. Singhal, about a society, PDMDS, that is Parkinson's Disease and Movement Disorder Society. So now I would like to welcome our CEO, Dr. Maria Barreto. She has been an inspiration for all of us since the last 20 years, and her dedication for improving lives have been incredible. So welcoming Dr. Maria for today.
Thanks, Riya. Good morning. On behalf of Dr. Singhal and the PDMDS team, I welcome you to this webinar. It is an honor and privilege for me to welcome our speaker at today's webinar, the eminent neurologist, Dr. Sarosh Katrak. Dr. Katrak is Professor Emeritus at the Grant Medical College and Sir J.J. Group of Hospitals, and Emeritus Director of the Jaslok Hospital. He was Chairman of the Teaching Course Committee of the World Federation of Neurology and has over 50 years of teaching experience in neurology. Dr. Katrak has been the past president of the PDMDS. He has encouraged and supported our work through his insightful contributions, and always graciously accepted our invitation to speak at and attend our programs, whilst also delighting us with his subtle humor and engaging storytelling of incidents and experiences. Thank you, Dr. Katrak. We are also privileged to have Dr. Jimmy Lal Kaka with us today, an eminent neurologist and a founder member of the PDMDS. Dr. Jimmy has been our mentor and guide through the years as we grew from one support group to the present over 70 support programs across our country. His support and encouragement in everything we do has enabled us to give PDMDS our very best. I now request Dr. Jimmy Kaka to say a few words.
Thank you, Maria. I am absolutely delighted to be here and even more delighted to listen to my mentor, Dr. Sarosh Katrak. He is a neurologist and teacher par excellence, and I have been privileged to have been taught by him. He possesses brilliant clinical skills. His powers of observation are second to none. He can pick up signs that none of us could pick up. And as far as teaching is concerned, he loves teaching, and I think I love listening to him, and you all will also fall in love with the way he teaches. He has been awarded several prestigious awards, but as Dr. Maria said, the most prestigious is the International World Federation of Neurology Medal as an international recognition for all the teaching services that he has done over the years. Extremely prestigious. And he has taught generations of neurologists, not only neurologists, but MD students and even undergraduate students. His lectures, his clinics at JJ Hospital, at Jaslok Hospital are, something, they was really so wonderful. And I can also tell you now that there is, if you all can, at any stage, there's been a wonderful IAN talk show, episode 5 on YouTube. You can all access it. This is Dr. Sarosh Katrak and his life from the time he was born, a rather big baby. And you can listen to him and you will be all enthralled. It's IAN Talk Show, episode 5, YouTube. I think let me not waste any time. I am as eager as you to listen to him. So please go ahead, sir. Pleasure to have you.
Thank you, Jimmy, and for that kind introduction and for always being there with us. I now welcome Dr. Sarosh Katrak to start with the presentation.
Ria, I'm pressing the share screen, but the share screen is in the background. So if I close this, no.
So can I share on your behalf?
No, because I want full control of my
So
slide.
we'll be able to do it. We did it earlier, so I'm sure he'll be able to manage that.
Are my slides seen?
Not yet.
Not yet.
Oh, what's happened?
Yeah, we can take.
Something's
We
gone
can
wrong.
take a few more. We can take a few moments. No problem.
No, something's gone wrong. You all can hear me, ne?
Yes, we
Yes, we can
can.
hear you.
Then you don't need to see my face. But you all can't see the slides, no?
So I'll guide you through the steps again. Can you go on share?
It has the whole thing about the Zoom has gone. The video is on. I do not know how to go back.
You need to, can you minimize Zoom and again maximize it?
I can stop the slideshow. Yeah. I've stopped the slideshow, but I have to go back to Zoom, no?
Yes, you have to go back to Zoom.
Right.
Do you
Now
see the share now?
I share screen.
Yes.
Now is the
Yes.
slides visible?
Yes,
Yes, the
yes,
slide is
doctor.
visible.
Perfect.
Now can I minimize the
No, you need to
people
go
here?
on with this slide. You need to go on with this slide. Can you put it on full screen, sir?
Yeah, I'll put it on full screen.
Yes.
But my video is not.
We can see your video.
No, we can see you, sir.
Oh, you can see me. Fine.
Yes.
Good. As long as I can't see myself, that's very much better. I just
Yeah.
like to put the pointer, laser pointer on.
Yeah,
And leave the laser pointer there.
excellent. We
Anyway.
can see the screen
And we can see you. So we're all set
and
to
you.
go.
You all can
Perfect.
see me, but I can't see myself. I don't know why.
That's okay.
I'm seeing Maria, which is a much better. Now somebody's kept me on. Okay. Now, good morning, everybody. This talk is called Parkinson's disease, prediction and prevention. But I would like to talk on what is new in Parkinson's disease research. And therefore, I'm going to talk on the microbiome gut-brain axis and prodromal Parkinson's disease. Now, these are all very big words, but I'll try and simplify everything as I go along with the lecture. Now, let me start with the microbiome gut-brain axis. Gut meaning your GI system, gastrointestinal system. Okay. Now, what is the old concept? The old concept is that the GI system talks to the brain. And let me give you an example of it. When you feel hungry, signals are sent from your stomach to the brain. And the brain interprets that as hunger through various centers in the brain. And then when you eat, you feel full and the brain makes you feel full. So the GI system has been talking to the brain for centuries. This concept is centuries old. So what is new? What is new is that the microflora in the human gut plays a preeminent role in the gut-brain axis. The gut microflora composition affects the brain, and the brain can affect the microflora composition of your gut. Therefore, this is a bidirectional thing. So if you see, the gut sends certain signals through certain immune pathways, hormonal pathways, endocrine pathways, and neural pathways to the brain. The neural pathways to the brain is via the vagus nerve. Now, the vagus nerve also controls certain autonomic functions. So the brain controls the GI system through the autonomic system. So it is a closed loop circulation, so that you have a bidirectional communication between the brain and the gut. Now, the human being has trillions of microorganisms, but most of those microorganisms reside in your gut. They are composed of bacteria, viruses, fungi. The most common example is yeast, and other microorganisms. And collectively, all these organisms are known as microbiomes. They not only help you in the digestion of your food, but they also have certain nutritional responses, which I'll talk about later. They also take part in your circadian rhythmicity. Now, what is the circadian pattern? That there's a certain time of the day in which you go to sleep and certain time of the day in which you remain awake. That is your sleep-wake cycle, which is a circadian rhythm cycle. During sleep, your pulse goes slow, your BP comes down, and your brain gets refreshed. And during daytime, all the BP goes up slightly, the pulse rate goes up slightly. And all this is controlled by your circadian rhythmicity. The gut microbiomes also help in certain metabolic and they produce certain immunity factors. So they are also responsible for certain amount of immunity. And therefore, there's an intricate talk with the brain. And in health, the brain and the gut are in equilibrium. They are happy with each other. Now, within the gut, certain bacteria are beneficial. And I will be calling them collectively as the good guys. And certain bacteria or organisms are opportunistic. And I will be calling them the bad guys. In health, there is a balance and the beneficial microbiomes supersede over the opportunistic ones. But under unhealthy conditions and illnesses, the opportunistic microbiomes become more dominant. And that is known as dysbiosis. Now, dysbiosis is influenced by many factors, including mode of birth. If you are born naturally via the vaginal route, on your passage through the birth passages, your mother gives you a gift, a birthday present of good microbiomes. And nowadays, scientists are looking at vaginal delivery versus cesarean section and trying to see whether there is any effect on neurodevelopment based on your microbiomes that you inherited via a mode of birth. So there is a lot that is happening. All of you know that if you get a tummy infection, you get nausea, vomiting, loose stools. And that upsets your microbiomes. If you use antibiotics for any other reason, you all know that some people get a very big tummy upset. And that is because of disturbances in the microbiomes. This biosis is also affected by dietary patterns. And let me give you an example. In Tanzania, till very recently, I mean, the start of the century or the end of the previous century, most of the people were hunters. So they used to eat meat. And therefore, they had a particular pattern of their microflora. Now, agriculture has started and they are starting eating agricultural products. And there has been a change in the pattern of their microflora. Not that it is dysbiosis, but there is a change in the microflora because of the dietary patterns. But the worst thing that has happened is processed and ultra-processed foods, sweeteners, which you add to these aerated drinks, and emulsifiers, which you add to certain foods to make them look thick. Now, these are known to practically eliminate some of the species of microflora within your gut. And therefore, it is not wrong to call processed or ultra-processed foods as junk food. Okay. Lastly, environment. If you are exposed to insecticides, pesticides, etc., it changes your gut flora. Therefore, there is an awakening where people want to eat organic pesticide-free food. Okay. And lastly, you have genetic factors. You cannot go against your genes, but in the latter part of my talk, I will show you that research is even dealing with genetic factors.
Dr. Katra,
Yes.
a request if you could do a little bit of Hindi.
Okay, I'll try.
Yeah, thank you.
Fine. Now, this is just a cartoon to show that if the normal microflora of the gut is affected, यानी आपके पेट में गड़बड़ी होती है, तो there is dysbiosis. And that affects the brain. उसकी असर दिमाग पे होती है. और उसकी वजह से ये सब diseases पैदा हो सकते हैं. And you can get Alzheimer's disease, Parkinson's disease, depression and stress, and neurodevelopmental problems like autistic spectrum disorder. And even another condition called multiple sclerosis can be due to this gut-brain axis dysbiosis. Now, today's talk, I'm going to concentrate mainly on Parkinson's disease. Now, आप सबको पता है कि Parkinson's disease multiple factors की वजह से होता है, and it's a neurodegenerative problem. Now, each factor on its own cannot produce Parkinson's disease. But a combination of these risk factors can produce Parkinson's disease. Now, one of the risk factors is believed to be environmental, वातावरण. आपके वातावरण में पेस्टिसाइड्स है, आप वो हिट करके स्प्रे आता है, वो ज्यादा इस्तेमाल करते हो अपने किचन में, यानी उसके स्प्रेस आपके खाने में जा सकते एंड आप इंजेस्ट कर सकते हो पेस्टिसाइड्स. सेकेंडली, उम्र की वजह से भी ये अपना जो बेनिफिशियल फ्लोरा है वो कम हो जाता है और जो अपॉर्चुनिस्टिक फ्लोरा है वो ज्यादा हो जाता है, यानी डिसबायोसिस होता है जैसे अपनी उम्र बढ़ते हैं. ना वो डिसबायोसिस की वजह से आपको ऑक्सीडेटिव स्ट्रेस, अभी ऑक्सीडेटिव स्ट्रेस क्या है कि एकदम सुपर सैचुरेटेड ऑक्सीजन मॉलिक्यूल्स अगर होते हैं तो वो अपनी सेहत के लिए अच्छे नहीं. इसके लिए आप पढ़ते हो कि कभी लोग फ्रूट्स, वेजिटेबल्स, बेरीज, उसमें एंटीऑक्सीडेंट्स आते हैं, एंटीऑक्सीडेंट्स अगेंस्ट all this oxidative stress. Now, this oxidative stress produces low-grade inflammation, यानी सूजन, आपके आंतड़े की सूजन, लाइनिंग की सूजन, और उसकी वजह से वो लाइनिंग becomes leaky, यानी लीकेज होता है आपके इंटेस्टाइन्स में से. And let me try and explain that in this diagram. On the left-hand side, this is the normal gut flora, which is commensal, which is called commensal rich status. Okay, उसकी वजह से आपके intestines की lining healthy रहती है. Okay, और उसकी वजह से ये leakage नहीं होता into the blood. Now, there is something which is called as the blood-brain barrier. उसका मतलब क्या है कि जो ब्लड सर्कुलेट होता है ब्रेन में, वो ऑक्सीजन को या ग्लूकोज को जाने देता, लेकिन कोई टॉक्सिक मटेरियल होती है तो उसको वो जाने नहीं देती है, क्योंकि देयर इज अ बैरियर and that is called the blood-brain barrier. So all these healthy B cells, T cells, and all these fatty acids, they protect the blood-brain barrier and they prevent toxic material from entering the brain. However, if there is dysbiosis and there are pathogenic strains in your gut, they affect your cells. They produce inflammation or sujan of the cells. And they allow all this toxic material to go across. And through the blood supply and through the nerve supply, they produce neuroinflammation. And they disrupt the blood-brain barrier. And they allow toxic material to enter the brain. Now, this can enter via the bloodstream or it can enter via the vagus nerve. Now, as you all know, the abnormal protein in Parkinson's disease is called alpha-synuclein. If there is abnormal alpha-synuclein in your brain, in an area of your brain which is known as the substantia nigra, it destroys your dopaminergic cells and you develop Parkinson's disease. Now, what is now known is that the alpha-synuclein is present in your gut cells long before clinical symptoms of signs of Parkinson's appear. सालों पहले 10 साल 20 साल पहले ये सिनुक्लेन गट में प्रेजेंट रहती है. And what is the hypothesis which how is Parkinson's disease formed by the gut-brain axis? The hypothesis is that dysbiosis leads to chronic low-grade inflammation, sujan. That sujan produces a leaky gut, which I showed you just now. Now, because of all this, there are abnormal collections of alpha-synuclein in the gut. And these abnormal collections of alpha-synuclein are transported to the brain by the nerve vagus nerve, which supplies the intestines. Okay, to show you diagrammatically, this is your intestines. The microbiota imbalance occurs, producing dysbiosis. That dysbiosis produces neuroinflammation. This neuroinflammation allows abnormal aggregates or abnormal collection of alpha-synuclein. Now, this is just a demonstration of the abnormal alpha-synuclein aggregate. And that is conveyed by the vagus nerve to the brain. It gets deposited there and it produces Parkinson's disease. Now, there are two important components of this hypothesis. One is that you require dysbiosis, and second is you require transport via the vagus nerve. Now, do we have proof that this actually occurs? And the proof has come from some population studies. And let me come to that. There was a Swedish study. Now, please remember that in the Scandinavian country, the health services are run by the government, so that they have records of many, many, many years of Swedish or Danish patients. Okay. So what they did is they looked at patients with appendicectomy. Now, when you get appendix, it's an inflammation or this, and there's pus formation, and sometimes the appendix bursts, and it becomes an emergency surgery. Okay, but what it implies is that appendix removal implies that there was dysbiosis in the appendix, and that dysbiosis spread from the appendix to the rest of the intestines. So the appendicectomy indicates that there were dysbiosis in that patient at that time. And they followed up these patients for a period of 50 years after the appendicectomy. And lo and behold, what did they find? That the patients with appendicectomy have a lower risk of developing Parkinson's disease. So it shows that dysbiosis plays a role in the development of Parkinson's disease. Then there was a Danish and a Swedish study in which they did vagotomy. Now, please remember that the 2005 Nobel Prize was given to two doctors, Barry Marshall and Robin Warrers, because they showed that peptic ulcer was due to an infection. And peptic ulcer was not due to stress and hyperacidity and all that. So before 2005, for peptic ulcers, people were removing the influence of the vagus nerve by doing a vagotomy. So now you have a population of patients who earlier, before 2005, had a vagotomy done. And they wanted to test this hypothesis. So they followed up these vagotomy patients for more than 20 years. And again, vagotomy patients were resistant to Parkinson's disease. And if at all they developed Parkinson's disease, they developed it at a later age, at a very older age. So this hypothesis has some proof in population studies of this two population of people. Now, what is the other influence of these microbiomes on your Parkinson's disease? Now, many of you all know that there are two types और दो तरह के पार्किंसंस होते हैं. कोई पेशेंट्स में ट्रेमर्स ज्यादा होते हैं और कोई पेशेंट्स में ट्रेमर्स नहीं होते. लेकिन जो पेशेंट में ट्रेमर्स नहीं होते हैं उनको रिजिडिटी ज्यादा होती है, उन लोगों में चलने में दिक्कत ज्यादा होती है, वो बहुत स्लो हो जाते हैं और उनको रिपीटेड फॉल्स हो जाते हैं और उसकी वजह से उनका पार्किंसंस ज्यादा खराब तरह का पार्किंसंस. अभी लोगों ने फीसिस के एनालिसिस करके देखा है कि if there is more concentration of a bacteria called Enterobacteriaceae, those patients in whose stools there are many concentration of Enterobacterium, they tend to have a more akinetic rigid Parkinson's. In those patients, there is more extensive alpha-synuclein pathology, and those patients have a more severe constipation. Yani ye microbiota has some influence on the type of Parkinson's that you have and on the constipation that you have. Other studies have shown that if there is a bacterial overgrowth of a certain type of bacteria, if your Parkinson's disease was controlled, suddenly there's a deterioration in your motor function. And you get unpredictable motor fluctuations. Without any rhyme or reason, your motor control fluctuates. there is definitely poor absorption of your medication. And if you have a particular bacteria called Helicobacter pylori, big name, but just remember this, you can get improvement of your Parkinson's symptoms by taking a course of antibiotics and omeprazole, clarithromycin, amoxicillin, and omeprazole. So this triple therapy can improve your motor function on the same dose of L-Dopa that you are taking. So the point that I'm trying to tell you, okay, a healthy gut goes a long way in helping your treatment of Parkinson's disease. Please, who is this Yvette? She's making some notations on my slide. Kindly stop.
Yeah, doctor, we'll look into that.
It's okay. It was in the previous slide. All right. So what I'm trying to tell you all, कि अगर आपका gut सही रहता है, तो आपके पार्किंसंस में भी इंप्रूवमेंट हो सकता है. Okay. Now you all are taking L-Dopa. And let me give you some facts about L-Dopa in your gut. L-Dopa is the precursor. L-Dopa convert हो जाता है dopamine में, आपके शरीर में. And dopamine is a known neurotransmitter of the gut. It is highly concentrated in your intestines. And animal studies have shown that it has a protective effect. आपके आंतड़े को सुरक्षित रखते हैं, L-Dopa or dopamine. So it prevents gastric injury due to alcohol in experimental animals. If you block the dopamine receptors in your gut, this gastroprotective effect goes away. Therefore, I again repeat that proper gut health will ensure better absorption, pachan, constant concentration of L-Dopa that you take. Fluctuations are not there. The levels of L-Dopa will remain constant. And it will reduce the side effects which are associated with fluctuations in the level of your blood L-Dopa, namely the on-off phenomena, which many of you patients suffer from. And absolutely the doctor has to really scratch his brains to try and get rid of it. But one of the ways of getting rid of it is to maintain proper gut health. I'm not saying it is the only, but it is one of the ways to maintain or get rid of this phenomena, on-off phenomena. Now, how can you help to maintain a proper gut health? And now you have probiotics. What are probiotics? They are live microorganisms, jinda microorganisms, which when consumed in adequate amounts में अगर आप लेते हैं, so they will give you a health benefit. Okay, they will improve your gut health. They will improve your immunity. And what does probiotics do? I've already explained dysbiosis, which is leading to inflammation, and this leads to a leaky gut, and therefore this becomes a vicious cycle. But probiotics block this so that they help you to improve your gut health. And how can you take probiotics? They are present in fermented food. And see, these are the fermented foods in Indian cuisine that are very rich in probiotics. Dahi, mishti dahi, lassi, shrikhand. Then you have idli, dosa, dokla, kadhi. milk and legume based, so you have ragi or wheat, and you can make kulchas, naan, rabdi. Vegetable and fruit based pickles. So you have a variety of things in the Indian diet which can give you a lot of probiotics. If you're fond of Korean food, there's something called kimchi, which is fermented cabbage, carrots, soya, etc. In Japanese, it is called miso, which is fermented soya beans. And in Germany, it's called sauerkraut, which is actually fermented cabbage, gobi. Then there are prebiotics. Prebiotics are typically high fiber foods that act as foods for our microflora. So besides taking food for yourself, you are also feeding your microflora. And it improves the balance of beneficial microbiomes. And they are present in whole grain, bananas, green vegetables, onions, garlic, and soya beans. And nowadays, you also get a combination of pro and prebiotics available as food supplements. So there is a big thing about organic foods, free of insecticides, pesticides, probiotics, prebiotics, and all these things can improve your gut health and help your doctor control your Parkinson's in a better way. Now I will change lanes and I'll go on to the second part of my talk, which is on prodromal Parkinson's disease, as I call it PPD. Now, what is the meaning of prodromal Parkinson's disease? It refers to a stage of your Parkinson's disease in which there are symptoms and signs of neurodegeneration, which we can pick up. But the degeneration has not progressed sufficiently to diagnose Parkinson's disease through the classical motor signs of bradykinesia, means difficulty, slowness of walking, slowness of doing any movements, tremors, tightness, rigidity, and gait and stance. So that motor signs have not developed. But before the motor signs develop, we can pick up certain symptoms and signs. Now, I'll give you a little technical background. In 2003, a gentleman called, a scientist called Brack and his colleagues on autopsy material did a pathological staging of Parkinson's disease. And what they said, Parkinson's disease is not restricted only to the brain. I've already told you that Parkinson's disease is also there in your gut. And alpha-synuclein deposition starts many decades, many years before it comes into the brain. And it deposits in the olfactory bulb. What is the olfactory bulb? It is your sense of smell. Therefore, even before you develop Parkinson's disease, you will have abnormalities of smell. Either your smell becomes less and less, or you cannot differentiate between a good odor and a bad odor. It also gets deposited in the brainstem in a particular part of the vagus nerve, which is known as the dorsal motor nucleus. And that looks after your intestinal motility, movement, and therefore you get constipation. There are other areas of the brainstem which make mood disorders like anxiety and depression. And lastly, it gets deposited in an area of the brain which produces this RBD. Now, what is this RBD? It is known as REM, sleep, behavioral disorder. Now, let me explain to you a little bit about sleep. Sleep occurs in 4 stages. Very light sleep, where even the slightest sound outside will wake you up. Then the second stage of sleep is that you are having good sleep, but when you turn in bed, you wake up and adjust your bed cover. That is stage 2 of sleep. So intermittently you wake up and then you fall back to sleep. Stage 3 of sleep is that very deep sleep, as if you are dead to the world. And I can give you a classical example that when the Koina earthquake happened, my brother and I were fast asleep and we never even felt the tremor of the earthquake. We were so fast asleep. As you age, that part of your sleep becomes less and less. And the 4th stage of the sleep is what is known as REM, very rapid eye movements. And during that stage of sleep, people have dreams. Now, some people, when they get into that stage of sleep, they develop a behavioral disorder, meaning they enact or mimic their dreams. So they vocalize. If they are dreaming that they are chasing a thief, they will shout chor chor. If they are fighting with somebody in their dreams, they will box the person. And usually it is the spouse who is lying by the side of the patient who will get all the blows. So that is known as RBD. And RBD is now found out to be a very dominant prodromal Parkinson's marker. Ultimately, the substantia nigra in the brain, Brack had shown, is a latecomer. It gets involved late. So now what is the research that is going on? The research is going on to try and pick up this stage of Parkinson's disease, prodromal Parkinson's disease. And now let me show you in a diagram. The pathology starts, but there's nothing. Nowadays, then the neurodegeneration starts. And you can pick up this neurodegeneration by some very fancy tests like dopamine transport imaging techniques, many other laboratory techniques, very fancy. But at this stage, the patient has practically no symptoms. Then the neurodegeneration progresses and you get this prodromal period in which you will have sleep disturbances, constipation, sense of smell goes down. And nowadays, depression and anxiety, these are the main ones. But there have been many others which have been now recognized. And I would like to draw your attention to this one, subtle motor symptoms. They are very subtle, and I will show you in the latter half of my talk on some of the slides what they are doing to pick up this subtle motor symptoms. And then when it progresses much more, you develop all the signs of Parkinson's disease, which are very well known to you all. So now I would like to stress, we would like to pick up your Parkinson's at this stage. Now, in 2008, all this research started. And as you can see on the left-hand column, that all these markers were identified. And these were the number of studies that were done there. Okay. However, by 2018, you have 16 markers. But some of them are tissue biopsy, some fancy scans, dopamine functional imaging, etc. They are not clinical. These are all clinical. Okay. Now, how did they go about getting all this information? If you know the prevalence of Parkinson's, it occurs in only 2 to 3% of the general population above the age of 65. So if we studied that population, we would hardly get any markers. So what researchers did is they studied smaller families of Parkinson's disease. They studied high-risk studies. Mainly, they studied REM, sleep behavior disorder. Then they modified certain large epidemiological studies midway to suit their purpose of finding out certain prodromal Parkinson's markers. And lastly, they had these neuroimaging markers like Trodat scan. And surprisingly, nowadays, people are doing tissue biopsies. And if you take a submandibular gland that is just below your jawbone, there is a gland which is called the submandibular gland. And if you take it out and you stain it for alpha-synuclein, which is a very specialized stain, you can pick up many years before Parkinson's develops. And nowadays, they've started the same technique in skin biopsies. Lastly, there's some information and data available from the Danish National Pathological Registry, in which they followed patients of Parkinson's and asked them a question. Did you have a biopsy for any reason in the past? And when they analyzed all those biopsies, they found out that those biopsies showed evidence of alpha-synuclein, even if it was 7 years before the patient developed Parkinson's. So we have a lot of data. But please remember that this data are not facts. The facts do not become information. Information does not become knowledge. And knowledge does not become wisdom. Knowledge can only become wisdom with experience. So what they are doing now is to try and refine all these markers. And they are trying to do, this is the MDS, is the Movement Disorder Society. They put up a group of experts and they looked at all these markers. And they did based on age, diagnostic. I won't go deal with you with all this technicality. But what I'll tell you is that if there is a 80% chance that one of these markers predicts development of Parkinson's disease, it is called the predictive value of that marker. Now, we know that these markers are well established, and most of these markers are non-motor. Main ones are REM, sleep behavior disorder, hyposmia, meaning sense of smell, constipation, and mood disorders, namely depression and anxiety. What we are doing is trying to refine the predictive value of each marker. Can the predictive value change with age, sex, and other confounding factors? And as we are studying Parkinson's disease more and more, or these markers more and more, we find that more prodromal markers may evolve as we do more cohort population studies. But question is, what is the predictive value of those markers? Now, I'm just showing you this example. This is an article 2022. Don't bother about what the article shows. But what I would like to show you is that they did simple clinical variables. And this was a test which was done. Now, why is Yvette doing all that?
Try and take her. We'll have to try
I
and
don't know who this person is, but
no,
she's
we'll
been
try and we'll
scribbling
try.
on my slides quite a lot. Anyway, what they did is they did a simple test, and these tests are done at home. And you can transmit the results of your self-assessment to the examiners via the internet, via email or your smartphone. And many of these tests are done on the smartphone. And what are these subtle motor signs? Simple reaction time or choice reaction time. And upper scale is prediction values for 3 years. That means all these things predicted Parkinson's disease 3 years before. And this is 5 years before, or it happened 5 years hence. Okay. So see the number of markers that we have got. Now, this is a very interesting study. And please let me point out that this study was published in a very prestigious neurological journal, 2025, January issue or February issue. And see what the results are. I will just summarize the results. Men with constipation, probable REM sleep behavior disorder, and hyposmia. If all three are there, you have a 23-fold higher risk of receiving a PD diagnosis in the subsequent 3 years. So you're likely to develop Parkinson's. Your risk is 23 folds higher. The risk of Parkinson's disease was 21-fold higher in men who had that probability, predictive value of greater than 0.8, which translates to 80%, compared to men without those risk features. That co-occurrence of these three motor features, that means constipation, RE, and hyposmia, and the MDS-based probability, they had comparative predictive values. So it was matching. A combination of these three features was stronger predictive value than each feature by itself. And conclusion was our study demonstrated that a combination of key symptoms and signs strongly predicts future clinically manifest Parkinson's. So now we doctors are able to predict your Parkinson's disease. And now let me give you a glimpse to the future. This study is to be presented between the 5th to 9th of April. But I'm showing it to you. It was done in Portland, Oregon, United States. And they did the veterans, and they examined veterans with OSA, meaning obstructive sleep apnea. Those patients snore hell of a lot, and during sleep, they stop breathing for a while when they are snoring too much. Now, I won't go into this, but what I'd like to show you is that lower rates of Parkinson's disease development if these people started this treatment, which is called continuous positive airway pressure, so that there is a machine which pumps air into your airways. So if you start that immediately after the diagnosis of OSA, there were lower rates of Parkinson's disease development. And if you did not take CPAP, or if CPAP was started after 2 years, the rates of Parkinson's disease development was the same. So don't start the treatment after 2 years. Start it immediately, and you may prevent the development of Parkinson's. That is the take-home message from this study. Now, what is all this research worth? To the neurologist, I suppose like Dr. Jimmy Lalkaka, he finds this data very interesting and informative. But to the patient, you are likely to ask me, what is the practical use of all this research to me? Can you cure my Parkinson's? And the answer to that, very frankly, today is no. But let me give you an example of Alzheimer's disease. Nowadays, Alzheimer's disease has a treatment which we call disease-modifying treatment. 10 years ago, 20 years ago, we did not have it. Nowadays, we have methods to predict Alzheimer's disease. But what was the sense of predicting Alzheimer's disease when I had no treatment? So this is the same question that a patient of Parkinson's disease is going to ask me. And the most critical gap in Parkinson's disease research is the development of a neuroprotective therapy, a therapy which protects your brain from developing the changes of Parkinson's disease, and which we call as disease-modifying therapy. However, let me assure you that there are extremely promising disease-modifying therapies in stages of development. They are being developed. Anti-alpha-synuclein therapies. If you have this LRKK2 gene, and this gene is the most frequent gene in familial Parkinson's. Nowadays, the Japanese workers are working on a drug. Most advanced drug in therapy of Parkinson's is this LRKK2 inhibitor. So even if you have this LRKK2 mutation and a familial Parkinson's disease, this inhibitor will prevent that gene from taking effect, and you may not get Parkinson's disease. Therefore, we have to try out all these therapies, and prodromal Parkinson's disease is the best opportunity to test these therapies. And if there is a discovery of a disease-modifying agent, it will change all this talk on prodromal Parkinson's from a research or academic issue to a compelling clinical need. Your children will be coming to us to get all these tests done, to know whether they will develop Parkinson's or not. And if we treat them, the Parkinson's may or may not develop. If it does develop, it will be in a very mild form. So there are potential benefits and potential harm. At present, I think the main thing is to establish a trial-ready cohort of neuroprotective studies. However, let me stress on this. We can give you advice on lifestyle measurements, exercises, aerobic exercises, dance therapy, dietary modifications, which can delay the onset of Parkinson's disease. You can managing beneficiaries, addressing comorbid. If you have an irritable bowel, if you have other things, we can manage all those. And we can plan for the future. On the flip side, that is, if a doctor cannot do any good, we should try and do no harm. Therefore, we have tried to do no harm by removing a very small possibility of false positive diagnosis. That means an erroneous diagnosis, a wrong diagnosis. Impact on insurance companies and employment, this is more a Western concept. And social and family impact. So when you get a diagnosis, you are going to develop Parkinson, it has an impact on you and your family. Therefore, ladies and gentlemen, this is my last slide. Any effective disease-modifying therapy will make it essential to predict Parkinson's, but the prediction should be reliable, reliably detect and diagnose prodromal Parkinson's disease. And it will be essential to prevent Parkinson's by effectively treating prodromal Parkinson's disease. Therefore, ladies and gentlemen, I think a more appropriate title of my talk would have been Parkinson's disease at the crossroad of prediction and prevention. Thank you. Shall I stop the screen sharing?
Yes, doctor.
Yes, sir.
So thank you very much, Dr. Katrak. That was really informative, and I think we've learned a lot too. Dr. Jimmy?
Yeah, absolutely fantastic. Blown away. Absolutely, absolutely wonderful. It's the how slowly and carefully he explains each and everything in his slide, and yet manages to finish such a large quantum. Absolutely wonderful. And I mean, we talk about prodromal features. The important thing is we need a disease modifying therapy. And it is at the crossroads. So it is so beautifully woven. Thank you very much, sir. It was wonderful.
So thank you everyone for being part of this webinar, and Dr. Katrak, Dr. Jimmy, for being here with us and spending this morning. I think we've all learned a lot. We're going to continue with this webinar. We've already done 2 webinars. One was on dance for Parkinson's, one was on yoga, and today we had an educational talk. As you all know, PDMDS is moving into completing 25 years. So we thought this entire year we'll do a series of webinars. I also take this opportunity to invite you all to the World Parkinson's Day celebration that is happening on the 7th of April, a time when we commemorate the lives you lead. We honor your journey with Parkinson's, and we express our gratitude for allowing us as the PDMDS to be part of that journey. So thank you all, and look forward to being with us on the 7th of April. Thank you.
Maria, no questions.
No, we're not going into questions, sir.
Yeah, I think I exceeded my time.
No, I think it was
No,
perfect.
it was absolutely perfect. We started
Yeah.
late. I
There-
think it was genuinely.
Yeah, there have been no relevant questions. So
No, but if the questions come in later on,
Are we still live
So-
streaming?
yes,
I
we
think
are.
you can send them to me
I
Yes.
will do that, Dr.
and
Katrak.
I'll try to answer them as much as I can.
Sure. And we can put it up on our website, and we always put the talk up on our YouTube channel, so we could
Oh, that
follow.
would be terrific.
Yeah.
You know how many hours, man hours, preparing this?
Must be.
So we have shared a screen with everybody, giving the details of our World Parkinson's Day celebration on the 7th of April. We would like everybody to please join us in this celebration. Thank you everyone for joining in today. Have a great day ahead.
Thank you. Thank you, everybody.
Thank you.